The clinic director, Christine Eaton of the Community Action Health Clinic, located in Portsmouth, Ohio, says she sees great benefit in being electronic since there's no more searching for paper charts. She also says it's saving the clinic money.
We spent hours looking for charts before. Hours. I mean, you couldn't find them. You never knew where they were. Then you had to file charts. Then you had to pull charts for clinics. That took a lot of time in a 40-hour week. Done. Gone. Not to mention copying records. Now they're faxed automatically, no paper.
The nurses at the clinic like the electronic charts too. They say it has made their jobs easier.
Well, in prenatal we usually have 120 active patients at a time. When they all call in here asking questions, we always have to go and get the paper chart and, you know, put them on hold. It's a lot easier to look them up on the computer. It is.
With me, general med, sometimes the same patients would also be in our GYN clinic. So when I needed a chart, I'd start out front where we filed charts. If it wasn't there, I'd go right there behind the door. If it wasn't there, then I'd go to the GYN. It may be in Laura's office. You search this whole building looking for a chart. I don't have to do that anymore. Pull it up on the computer. That's it.
The software has simplified the process of both sending out for lab work and receiving it, says General Medical Nurse Christine Thomas.
Because I get the lab first. I marry it to where it was ordered by her, but then I go in and put in the A1C value. So when we run that test again on that patient 6 months from now, it will graph it. We'll see if it's going up or coming down. So trending will be a big thing. Probably getting close to some of that 6-month mark. Right now we'll start seeing some of that trending. For our lab orders, we have eliminated the hospital computer system because now in this system we can print the lab order from it, take it into the lab and send that with our specimens. Before, I'd have to come in, say they need this, this, and this. Either I would go to the hospital computer, search the patient, or if it was new, put the information in, order the lab, print out their sheet, send it. We've eliminated their whole computer system and copier, printer, whatever. We don't even need it anymore.
When patients leave the clinic, they know what they were treated for with a care summary and walk away with an active medication list. Christine Thomas says they really like it, and it's helping them take control of their own health care.
Clinical summary that we print now at the end of the visit and give to our patients, it has the reason they come in that day, the diagnosis, the reason, what we're treating them for. It has what their medicines were when they come in, and maybe there's been a dose change. So now below that will be current medication list, or that may not be the exact word, but active medication list maybe. So that is now what they go by as far as medications. It has their blood pressure, their height, weight, pulse.
Any test that's ordered.
Any test that's ordered, any labs that's been done, and then any referrals, if any referrals have been made, when she wants them back, and then we schedule their next appointment. It all prints out on this clinical summary. When I hand that to my patients in general med, they like it. They like seeing exactly what medications they're on, because most of them kind of know but don't know the exact dosage or how often they take it, and they like knowing that they can look at that and it tells them that. They like the fact that their blood pressure and weight is on it, because when they come the next time they're going to get another one and they can compare it. And they're not keeping track or going out front to make their appointment. They're getting it all right in the room, and instead of having a card, it's right on that paper. And I highlight it so they can go home and do whatever. A lot of them are starting folders at home. They've told me they're going to get them a folder and start keeping it in it.
To start, the system was quite a transition. The staff had a lot to learn, but in the end, they really like it and find it extremely helpful.
It was difficult at first just because I've only been here a little over a year. So I was just really getting used to their chart, their system, and then had to switch it. But it's been worth it. It was an adjustment at first, but
yeah. For me, I've been here 4 years and I appreciated the change. I've chased charts all over this building for 4 years. I was more than ready for it to be right here.
We'd like to thank Community Action Health Clinic for sharing their time and experience with us about how electronic health records have transformed their workflow. For more information about how you can receive CliniSync services at no cost, visit www.clinisync.org.